Bismillahirrahmanirrahim. So dry eye is classified into the two basic types: aqueous deficient and the evaporative type. Aqueous deficient is further divided into the Sjogren's syndrome dry eye and the non-Sjogren dry eye. Sjogren's syndrome dry eye can be primary or secondary, and non-Sjogren dry eye can be due to the lacrimal deficiency, that is primary, that is age related dry eye, congenital alachremia, familial dysautonomia, or it can be secondary like inflammatory lacrimal gland infiltration, neoplastic lacrimal gland infiltration, AIDS, graft versus host disease, lacrimal gland, or the nerve ablation. Then second one is lacrimal gland duct obstruction. It can be due to the trachoma. It can be due to cicatricial pemphigoid, due to the chemical injury, due to the Steven-Johnson syndrome (SJS). Third one is reflex block. That is, it can be due to the reflex hyposecretion by the sensory mechanism, contact lens wears, diabetes, refractive surgeries, neurotrophic keratitis, or it can be motor block. That is by the seventh cranial nerve damage or the systemic drugs. Now comes the second one. Second one is evaporative, which involves the intrinsic and the extrinsic factors. Intrinsic factors involve the meibomian gland deficiency, which involves the posterior blepharitis (MGD). This is called as the MGD, meibomian gland deficiency. That is posterior blepharitis or rosacea. Then disorders of the lid aperture, that is excessive scleral jaw, lid retraction, proptosis, facial nerve palsy, low blink rate, which involve the Parkinson's disease, prolonged computer monitor use, reading, watching television, and the last one is the drug action like antihistamines, like anti-allergics, beta blockers, antispasmodics, diuretics, medications used to manage the increased blood pressure, that is beta blockers, diuretics. Extrinsic factors involve the vitamin A deficiency, topical drugs, including the effect of preservatives. प्रेजर्वेटिव वाली दवाइयाँ इस्तेमाल करने से भी ड्राई आई हो सकती है. कॉन्टैक्ट लेंस वियर. इसके अलावा ocular surface disease such as allergic conjunctivitis can also cause the dry eye disease. Whether a patient has a primary aqueous deficiency or the evaporative dry eye, the end result is ocular surface inflammation and discomfort. This is very important.